And let us have a look at the procedures. So the task was to prepare the leaflets that give a patient information about, and the first procedure is on the list is colostomy. So who was responsible for this leaflet? Yes, guys.
Sir.
Who? Ala Malik, you?
And Danish.
Danish? Danish and Hala Malik. Hala Malik is here. I can see your face. And Danish, can you switch on the camera so I can remember how you look like? Yes, please. Yes, hello, Danish. I'm so glad to see you. Yes. And Hala Malik. Hala Malik. Okay, guys. So you, what I need to do is to allow you to share the screen, right? So here we are. Yes, now you can show us your presentation.
Can we see?
Yes, we can.
Yes, ma'am. Can I start?
Yes, you can. Start, please.
Yes, ma'am. This is we are talking about the colostomy, and this is a surgical procedure which is done in the abdomen, and the patient is given information from the hospital or from the doctor before and after the colostomy. Let me talk about the preparations needed before colostomy. So before the surgery, the doctor will likely ask you to fast for at least 12 hours before the surgery, and also doctor will check the medical history because some people may be allergic to some medication. So the doctor will take blood samples, perform a physical examination, and also check our complete medical history. And also doctor will give you a laxative or an enema to take the night before the surgery to help cleanse your bowels. And also the doctor will set you should prepare to stay at the hospital for 3 to 7 days. So arrange and pack your things before that. And also a nurse will place an intravenous, just before the surgery, a nurse will place an intravenous access or IV to give you medications and also the general anesthesia. And this will help the patient to sleep painlessly during the surgery. And also the doctor will tell about the ostomy pouching and also prescribe some oral medication. And talking about the things to look out after colostomy, doctor will tell us to stay in hospital for some days to check if you have any problem with the digestive system, because the surgery is done on the stomach. So there may be some problem with digestive system for some people. So the doctor will tell you to stay in the hospital for some time. And next, the doctor will tell us to take only ice tea to ease your thirst after the first day of the surgery. Some people eat normally within 2 days after colostomy. However, eventually you can have liquid and soft food. These restrictions are also for our safety. And also, the patient will given instructions that how to use a colostomy bags correctly. Colostomy bags are given after a colostomy surgery. And a colostomy bag is where your feces will collect while you have your colostomy. And also, hospital medical staff will also instruct you on our diet, the patient's diet, activity level, and more. And also, it is important to follow these instructions. And after the surgery in initial days, the stoma will be swollen. Stoma is the cutting of our stomach that is for surgery, and it will be swollen and large, and gradually it would change. And also, doctor will instruct us to look after the changing color of both stoma and the stomach. And let me hand over to Hala Malik to talk about the reliability and also the side effects of this concept.
Okay.
Now, when we talk about the whether the colostomy is reliable, we can say that it is reliable. It helps the person to live more easily and actively, and also it can provide a healthy long life to the person. But there is an the patient may feel discomfort or issues with to get familiar with the ostomy bag change. For that, Danish has said that after the surgery, the nurse will give the correct procedure and information. So it will take a few weeks or for the patient to get familiar with the ostomy bag. Then in some patients, the colostomy will be reversible. So the difficulty in change of ostomy bag can be overcome by them. The ostomy is only reversible when it is end colostomy. Then when we talk about it is permanent or temporary, the most prominent ones are permanent. Then when we talk about are there any complications or side effects of having colostomy, we can say that it is rarely uncommon. It's mostly uncomplicated, and it can be done in two methods, which is open surgery or laparoscopy. And the main surgical risks which are faced are bleeding, infection, nearby organs get damaged, developing hernia at the portion of incision, skin irritation, colostomy of opening gets narrow. These are the main surgical risk which we can face. And also there is a risk which is faced due to the anesthesia problem, that is the breathing problems due to the amount and correct amount of giving the correct amount of anesthesia. And also the person may feel following condition. If the patient feels the following condition, the patient should consult the doctor as soon as possible. That are cramps that last more than 2 hours, continuous nausea or throwing up, bad or unusual odor for more than a week, change in your stomach color, blocked or bulging stomach, bleeding from the stomach opening or in the pouch, wound or cut in the stomach, serious skin irritations or sores, watery stool for more than 5 hours, and anything unusual concerns you, which in which it comes the pain, swelling, etc. And that's all from our partner.
Mhm. Okay, I see. Good, thank you. So does anyone have questions to the speakers? No questions? Does anyone want to comment on the presentation and the way it was, the information was presented? Maybe some recommendations or anything? No. Everything was clear, well presented. Thank you so much. Hala Malik and Danish. So, and if we go back to our list of procedures, the next procedure is called Ercp. And now we are going to listen how it is pronounced, the full name of this procedure. And who's going to speak about this? Ercp.
Me and Hepzibah, ma'am.
You?
And Hepzibah.
Okay, so, well, Sinju and Hepzibah. And yes, you may start, please. Mhm.
The topic which we have took is the leaflet about the procedure of ERCP. ERCP is the endoscopic retrograde cholangiopancreatography. And my group mate, Hepzibah Shibu.
Is the screen visible?
ERCP.
So
No.
we can't see.
No.
The screen is not visible.
So I guess we need to restart it one more time.
Is it visible now, ma'am?
Now, yes. Mhm. Mhm.
So talking about ERCP, the endoscopic retrograde cholangiopancreatography. This helps in diagnosing and treating the problems which we can find within the liver, gallbladder, and bile ducts and pancreas. This test is done with the help of two appliances, that is the endoscope as well as the X-ray. So talking about how to prepare for an ERCP, as for many other procedures, in this procedure also the patient is suggested that to not to drink or eat before 8 hours. The patient is only allowed to take small gulps of water with the prescribed medicines that is allowed by the doctor. That is to make the esophagus and the stomach free of any food or other objects, so that the procedures can be done perfectly. And the other thing is the patient is not allowed to smoke or drink or drinking alcohol, as well as chewing gums are also not allowed during this time, that is within this 8 hours prior to the procedure. And the doctor advises the patient also to stop other medications other than the medications given by the doctor at that time to avoid further complications. For example, we can say that if the patient is taking aspirin, we know that aspirin is to stop unnecessary blood clot and making the blood thin. So if there is a wound happening while doing a procedure, the blood will be oozing out continuously. So this will be a problem. So such medications are said to be stopped before such procedures like ERCP. And the patient is also asked to avoid the ornaments and the contact lens and the dentures before the ERCP, as we are using X-ray. This is also a general procedure which we undertake before the X-rays. The patient will be asked to remove all the ornaments and the contact lens and the dentures. And the next one is the patient must have a bystander with him. That this is because the patient will be given a sedative. So after a sedative, the patient may feel a certain uncomfortedness, that is the patient may feel nausea or giddiness. So the patient must have a bystander with him to take care of him or her. The next one is, what should I accept after an ERCP? After an ERCP, since this procedure takes place through the mouth, the tube is sent in through the mouth, through the esophagus to reach the organs. The patient may have a sore throat, and because of this, the doctors recommend the patients to eat soft food for a day or 2 days. And the next one is the patient may experience a bloating feeling or nausea because of the sedative after the procedure. And the patient is also forbidden to take heavy foods after 24 hours. And also between this 24 hours, the patient is not allowed to take alcohol. That is, drinking alcohol is also prohibited. And this procedure will be lasting for 30 to 90 minutes. And the patient can leave after 24 hours of observation. This 24 hours of observation is mandatory to look whether any other complications are coming up with the patients. So this 24 hours of observation is mandatory, and the patient have to stay in the hospital. And if there is no other complications, the patient can leave the hospital after this 24 hours, that after the sedation is off. Now I'd like to hand it over to Hepzibah for the next topic.
So now we are going to discuss about is ERCP reliable. ERCP is more reliable, and on talking about its accuracy, the test is more accurate, and there is false information is only found a little percentage. Like on talking about its accuracy, if 3% is only given as a false information, and the failure of this ERCP occurs only if the physician or the doctor cannot give this, cannot insert the endoscope in a proper way, and this only causes the ERCP to fail. Otherwise, it is more accurate. This test is more accurate and it is more reliable. And ERCP is a good test as well as it is more safe, and the abnormalities occurs only, is not common abnormalities, and it occurs only rarely, and it also helps to detect different types of problems like gallbladder stones, pancreatic cancers, etc. And Sinju, can you change the slides? And next, about are there any side effects, and if there is any complications in the ERCP test. So on talking about the side effects, ERCP causes only a rare side effects or any mild complications. So because we have already seen that it is more reliable, ERCP only cause a small type of complications, and not everyone will get this same type of complications or side effects. And sometimes in some people, they will get severe side effects, because if there is high sedation given to them, or like a more infection occurring in them, or some diseases may occur like pancreatitis, and this may cause life-threatening for the people. And some people may also get abdominal pain, and some of the side effects are like sore throat, bloating, tiredness are also side effects, but these side effects will be soon recovered, and if it is not recovered, we must consult the doctor once again. And this may not everyone will get severe side effects. So this is all from our portion. Thank you, ma'am.
Okay, thank you so much. So does anyone have any questions? So you were speaking, I have a question. You were speaking about accuracy of ERCP, that you say that it's more accurate and the results are more reliable compared to what kind of procedure? I mean, are there any alternatives to this procedure? How else can we observe, can we get a similar result? Can we analyze similar parts of the body?
We can only see on the portions like pancreas and colon, because we have seen that even in the ERCP means the full form of the ERCP itself is about the pancreas, that is the endoscopic retrograph cholangiopancreatography. So it gives only detailed information about if there is any cancer type diseases. This colon and pancreas are seen in this through this instruments like their endoscope, and only these organs are tested through this ERCP.
I see, but are there any other ways to analyze these organs?
Colonoscopy is used to check the colon, but while ERCP, it is more reliable as more than one organ can be tested in a continuous way. Like after the liver, gallbladder, and colon, all this can be tested one by one. So we can understand further complications, and further we can compare the changes within the organs. So it will be more reliable than the colonoscopy, endoscopy, all this alone. This is a combined form, so this is more reliable.
So a lot of new information for me. Thank you, doctors. Thank you. Okay. So, and we go back to our list, and the next is bronchoscopy. Who's going to speak about this?
Ma'am, me and my roommate Sultan.
Jan Farvin?
Yes, ma'am, and Sultan.
And who?
Sultan. Muringakod and Sultan.
Where is she?
Not she, he.
Sorry.
Sultan, ma'am.
Sultan, yes, I see. Sultan, can I see your face?
Yeah. Yes, ma'am. Could you see me?
No,
No?
no, not yet. Just a minute.
Camera is. I think network issue, ma'am.
Yes, now I see. Yes. Good. Well, so please start.
Yes, ma'am. So today, me and my groupmate Sultan, we are going to discuss about the bronchoscopy. So when we talk about bronchoscopy, it is a technique which is usually used to visualize inside our airway for diagnosis and therapeutic purpose by using this instrument bronchoscope, which can be seen in this figure. Typically, we can see two types of bronchoscope, which are rigid and flexible fiber optic. And for this purpose, the instrument, we usually use a bronchoscope, which has a slender flexible tube and has a width of 5 inches, that is 2.5 centimeter, and approximately 2 feet, that is 0.3 centimeter long, that uses the fibrotic technology. And let's talk about what are the preparation do we need to take before this bronchoscopy. The thing is that the whole instruction of this procedure is usually given by a hospital staff. It often these instructions are contained that we should not eat or drink after midnight on the night before you are going for this test. If you are taken medication daily, ask your doctors that whether you want to continue that medication or not. And then you will be asked to remove all the glasses, hair, hearings, jewels, all the accessories, whatever we are using, we should remove it before we are going to this procedure. And if you are going to leave the hospital after this procedure, plan ahead that ask someone to take you to home. And for explaining about the procedure, let me hand over to Sultan.
While talking about the procedure, firstly, a piece of gauze is placed in the upper teeth to avoid the injury. And secondly, a proper size of bronchoscope is lubricated with a swab of autoclaved liquid paraffin or jelly held by a shaft in the right hand in a pen-like fashion. And this retract the lid and guide the bronchoscope with the left hand. Look through the scope and identify the tip of epiglottis and pass the scope behind it, and this epiglottis lifted forward to expose the glottis and rotate the scope about 90 degrees in the clockwise direction, and so that the tip in this axis of glottis. Once the trachea it enters through trachea, the scope is rotated back to its original position, and generally they advance the scope and the tracheobronchial pre-examined, and the axis of bronchoscope should correspond with the axis of trachea and the bronchi. And the direct vision, right angled and the retrograde and telescope can be used for the magnification of the detailed information. And the biopsy of the lesion of suspicious area can be also taken, and the secretion can be collectively exfoliate and exfolicytology or bacteriology for examination. Now talking about the precautions during the bronchoscopy. Firstly, about the select a proper size and do not force through closed glottis. And repeated removal and the introduction should be avoided and should not prolong more than 20 minutes in infant and children. And while talking about what can I expect after the bronchoscopy, and sometimes you may not remember much afterward because of the anesthesia, and the medical team will keep an eye on you for a few minutes to make sure that there isn't any problem to you, and you won't able to eat or drink until the numbness is gone. You can swallow as usually, and start with a sip of water and soft drinks that may help you. And in the next few days, you may have throat or hoarseness, and cough drops can help, and call your doctor if you want. It is from our part, ma'am.
Mhm. Okay, I see. So thank you. Does anyone have a question or recommendation? I have some comment about the instructions you show on your presentation. I mean that some information was given from the instructions to doctors. The task was to write a leaflet that explains the procedure to a patient. So the part that Sultan, you were presenting, you should have better made some changes in this in the description of the procedure, like you are explaining to a patient what's going to happen, not just the instructions to a doctor. Just
Yes,
choose the size of the tube. The patient doesn't need this information, right?
Yeah.
Okay. So, and you should also try to change the technical medical terms with the simpler words so that the patient should understand it easily.
Helpful.
Okay, thank you. Well, so, and if we move to the next, to the list of the procedures, the next procedure is herniorrhaphy. So who's going to present it?
Yes, ma'am.
So who? Taib
Yes, ma'am. And Labib, ma'am.
and Labib. Mhm. Okay. So, and yes, I can see Taib and Labib.
Could you see?
Yes. Mhm.
Yeah. Our topic is herniorrhaphy. I and the Chamata Umar Labib are going to present this and telling about the herniorrhaphy. Herniorrhaphy is the surgical repair of a hernia in which a surgeon fixes the weakness in your abdominal wall. A hernia arises when a weak spot in the muscles of your abdominal wall permits an internal portion of your body to push through. And telling about the procedure for the herniorrhaphy, it's that patients should not eat or drink anything after the midnight. That is the night before the surgery. The second point is that take a bath or shower before you come in for your that is the herniorrhaphy surgery. And the third point is that please don't need to shave the surgical site by yourself. And the next point is that if you are taking any medication, tell your doctor. It may need to be stopped before the surgery. The last point is that if you have a sedative, have somebody accompany you home. Now I will hand over it to Levi.
Yes, ma'am. I'm taking the possible risks and the complications about this herniorrhaphy. So after the surgery, sometimes there would be an infection or bleeding at the site of incision, and also rarely there can occur a nerve damage, and also some people can have a negative reactions to this one anesthetic. And occasionally there is a chance for a mesh infection, and rarely in men, testicular atrophy can occur. Not everyone have what numbness of the skin, and rarely there would be a damage to intra-abdominal organs. So that's all about our topic, ma'am. Herniorrhaphy.
Okay, thank you. So, what about the questions? Is everything clear? The other students?
Yes, ma'am.
No questions. Okay. So, and the next, so procedure is blood test, right? So it is presented by who? Asna?
Me and Simcha, ma'am.
Start, please.
Hello, ma'am.
Hello, yes, we can see.
Yes, ma'am. We are going to talk about the blood test. First of all, there are many instructions giving to a patient before taking the blood test. The first step is for the blood test is before taking blood test is the patient should drink plenty of water before the appointment. As we told to a patient, they have some doubt about this, so we can clear about it. It helps the drinking of water helps the patient, because when we drinking the water, there is hydration occurs, so the blood volume goes up, so it is easy to identify the vein. The second step is having your meal before the test. It's prevent the patient from feeling lightheaded after donating the blood. So it is better to eat something before the test, because the blood loss may lose the energy of the body, so it can't do some metabolic activities. So the third step before taking the blood test is we should wear the short sleeved shirt. So the patient should wear short sleeved shirt. If the dress will be tight or fully sleeved, the doctors can't identify where the correct position of veins. So a short sleeved shirt helps assessing the veins easier. And the last step is taking stopping taking the aspirin, because aspirin makes some allergies for some patients and it will make some further complications. And the next step is the procedure of the blood test. For the first step, we should ask to expose the arm, then place elastic band around the limb. We have to go and take the blood. So we can ask for the patient in this way, can you please expose your arm? This will help us to identify your vein easily. And the second step is the identification of vein. And after identifying the vein, clean the targeted vein with the alcohol. So the patients we can say to the patient that this is mainly done because of sometimes people may feel difficulty while inserting the needle. So it is helps to use alcohol, and it also helps to clean that area. And the next step is insert needle to skin to assess the vein. And after inserting vein, blood is taken and release the tourniquet and remove the syringe from that area, and apply gentle pressure or bandage to prevent further bleeding in that area. And some people get nervous while taking the blood. We can say to the patient that rarely this will lead to unconsciousness, not in every case. Now I am handovering to Asnya for saying about complications and side effects.
Ma'am, I'm talking about the complication and side effects of blood test. In some people, the bleeding may occur, but it's not lasting. And it's rarely some patients may get lightheadedness, occasionally unconsciousness, and it will be and some patients will be skin irritation from tape or adhesive from applied bandage is, and not for everyone, but the persons who suffers from allergies. And the side effects is soreness, brushing, rashes, etc. And the reliability of the blood test, it is most tests are not 100% reliable, and the stress can vary the result of the test, so it not completely accurate. And however, the blood test is used for diagnosis of many diseases. Next I'm talking about the steps to follow after the blood draw. And after this, the refrain from the exercise, because which may causes bleeding from that site. And we rich in food rich in iron and vegetables. It helps to replenish the loss of iron. And apply the cloth covered as palm to arm if we feel any kind of soreness.
and we eat a snack for energy, boosting food such as asparagus and cheese. That's all about, ma'am.
Okay, thank you. So does anyone have questions to the speakers? No. Okay, please stop demonstrating the screen. Yes, sharing the screen, okay. So we have about 3 minutes. It doesn't make sense to listen to the last group. Who has prepared the presentation about hemotherapy? Who are these people?
Me, Ansi and Remisha.
Your name? Ashwati?
Ashwati, Remisha and Ansi.
I see. I don't think we'll have enough time to listen to. That is why I suggest you to move your presentation to the next week. We'll start our class with listening to you. Ladies, is it okay?
Okay.
Okay. So please, you remind me, please, at the beginning of the class that we haven't listened to you. And so you see that. So for the next class, the task is already on the site, on the Moodle site. This is the grammar task, which deals with the phrasal verbs. So just refresh the information about what phrasal verbs you remember, which are used in medical practice. And so as you usually do, you should write the answers on the sheet of paper and then just make the take the photo or screen of the ready-made task and just upload the PDF file with your task to the Moodle site. So that is all we can do today. So have a good day. So take care of yourself